Anxiety disorders in children. Did you know anxiety issues impact 1 in 8 children? Everyone experiences fear and concern sometimes, but for youngsters with anxiety disorders, the world may seem terrifying and overwhelming. Without therapy, children with anxiety disorders are likely to suffer in school and in life, and are at higher risk for substance misuse. The good news is anxiety problems are treatable. Whether you're a parent, teacher, family member or friend, here's what you need to know about anxiety disorders in children. Signs of anxiety disorders. Kids hardly ever say they're anxious. They express their anxiety in various ways. One of the most typical signs of anxiety in children is frequent physical problems and avoidance of activities, such as school or extracurriculars. Headaches and stomachaches are 2 typical physical signs of worry. A kid who is feeling stress may have a hard time going to sleep at night, or may wake up at night. A kid who has been comfortably sleeping alone may ask to sleep in your bed or bedroom. Some youngsters eat more or less than normal when they are worried. Crying and clinging, especially following separations, can be another indication of anxiety. Angry outbursts and frequent irritability might really be symptoms of worry, not rage or disobedience. Additionally, constant negative thinking, "I'll never be good at this, no one loves me," difficulty concentrating, and excessive concern are also indicators of anxiety. Naturally, all children display similar symptoms on occasion. However, when these symptoms are persistent and impair the child's functioning, they may be indicative of an anxiety problem. Among the most prevalent anxiety disorders in children are the following. Generalized anxiety disorder, GAD, best described as excessive concern over a wide variety of topics. Generalized anxiety disorder affects between 3% and 5% of kids and teens. Children with GAD are frequently perfectionists who believe that if they do not get perfect grades or behave flawlessly in sports or at home, something awful will happen. Panic disorder is diagnosed in children who have experienced at least 2 sudden panic or anxiety attacks, followed by at least 1 month of worry or concern that another attack might occur at any time. Panic episodes may be particularly frightening for children, as they may be unaware of what is happening. Due to the physical nature of many of the symptoms of a panic attack, pounding heartbeat, shortness of breath, sweating, difficulty breathing, the kid may fear death. Social anxiety disorder. Children who suffer from social anxiety disorder, also known as social phobia, are terrified of being in the spotlight. They may be hesitant to speaking out in class and prevent social contacts. Separation anxiety disorder. Separation anxiety, intense emotions of discomfort when children are separated from familiar caregivers, is rather prevalent in children between the ages of 18 months and 3 years. At this time, it is a completely natural component of development and is rarely a cause for concern. However, older children who get highly distressed at the prospect of leaving you or who experience significant discomfort during separations may have separation anxiety disorder. Separation anxiety disorder affects around 4% of children and is most prevalent in those between the ages of 7 and 9. Selective mutism. A child who is unable to communicate with others may suffer from selective mutism. Many of these children converse freely at home, with friends, and with family members, but remain silent in other settings. Phobias. An unreasonable dread of a particular situation or object, enclosed places, or spiders, is a kind of anxiety disorder. Anxiety disorders risk factors. While anxiety affects everyone at times, certain individuals are at a greater risk of developing anxiety disorders. A child with a family history of anxiety disorders, panic attacks, or depression is more likely to develop an anxiety disorder than a child from a non-anxious household. Experts believe the familial link is a combination of genetics and social. Children may inherit genes that predispose them to develop anxiety disorders. Additionally, they may pick up nervous habits and thinking patterns from family members. A child's chance of developing anxiety disorders rises if he or she has a background of trauma, such as abuse, natural catastrophe, or war. Likewise, persistent exposure to stress, whether it is caused by poverty, a hazardous neighborhood, or family conflict, has the same effect. Treatment of childhood anxiety disorders. Treatment of anxiety disorders enables afflicted children to grow and develop freely from fear and concern. Psychotherapy and medicine are the two most often used therapies. Therapy assists children in overcoming their phobias. It may include exposure treatment, which involves gradually exposing children to fearful items or situations, and cognitive therapy, which teaches children how to replace unhelpful ideas that contribute to their anxiety. Make an appointment with a therapist who has expertise working with children who suffer from anxiety problems. In some instances, medication may be utilized, frequently in conjunction with treatment. Antidepressants and anti-anxiety medicines can both be beneficial for children who suffer from anxiety problems. Medication effectiveness might take many weeks. A kid who is prescribed medication to treat an anxiety condition should see a healthcare professional on a frequent basis to evaluate the drug's effectiveness and any adverse effects. Recognizing and managing anxiety problems in children can be difficult. Be patient and nice to one another. Most families find that anxiety problems are relatively controllable with enough time and support.